Hey guys, today we're going to be talking about the Ranger and going through the patient population that it's best for and how to set up the device. So the first thing to know is that it has to be plugged in to work. If it's unplugged, it's not going to work. So find yourself a handy outlet. And then there's going to be a power button. It's going to be on the side over here. You'll want to have it flipped upwards. You'll know that it's working if a number flashes across the top, and it should be red. There's only one temperature setting for this, so you don't have to set it to a certain setting. This is going to be great for any patients that either need to be administered saline or blood that would benefit them to be warmed. It can be transitioned into doing blood if you already have fluids, and we'll go over both sets of tubings that can be used. So the first thing you'll need is a liter of saline. This does not need to be pre-warmed saline because that's what the device is going to do. You'll grab your normal tubing set, and then you'll need to grab the Ranger tubing from the supply room. So it's just the blood fluid warming system. And the big thing is that you will need this extra tubing because this won't connect to the fluid directly. So a very important part is that when you go to load this tubing, you don't want to pre-prime this part of the tubing because it won't fit into the device. So you'll take the blue end, you'll take off the blue cap, and you will connect it to the end of the tubing that has the blue end, so blue to blue. And then you'll just twist it. And then the tricky part is make sure you put this the right side up, and it should just slide in. So you have to use okay. Then you can go ahead and prime the tubing. So you'll want to clamp here at the bottom, and then go ahead and open your roller clamp, and you should start to see the fluid come out on the other end. You can see it going in. So after you finish priming it, you'll go ahead and take the red cap off, and this will go to your patient's IV extension tubing, not directly to the hub. And then after that, you can set up a pump to the IV. You can treat this like an IV pull after that. You can set up your pump and set your rate, and then it'll function normally like any IV tubing, and it'll just warm either the fluid or the blood as it goes through the Ranger. If you need to massively infuse blood or large amounts of fluid, you can also use, there's a second type of tubing. It's also in the supply room, and it's gonna be the high flow tubing, so it's gonna be a little bit thicker. It comes in this big box, and this actually already has the blood tubing on it. So for this one, rather than using the normal tubing, you would have to get blood tubing if you wanted to administer blood, but this one has the two different ports that you can use to give blood, and it has the blood filter as well. This one you don't need any extra tubing, you'll use only this tubing. The insert looks the same, it'll be inserted the same way as well, and then same process, so the little red end will connect directly to your patient as well. You can put either the blood or your fluid on pressure bags with this tubing, and it'll help it rapidly infuse. If you guys have any questions about how to use the Ranger, it's normally found in the trauma bay, and you can ask the unit supervisors, any of the charge nurses, or any TNS. That's all available on shift.